Joining us now is Dr. Nicholas Freudenberg. He is a public health practitioner who currently serves as a distinguished professor at the City University of New York School of Public Health. His latest book is At What Cost? Modern Capitalism and the Future of Health. Dr. Freudenberg, thank you so much for joining us.
Thanks for having me. Pleasure to be here.
The pleasure is ours. I actually have the copy of the book with me right here, and as I've been pouring through it, you don't pull any punches in terms of how you diagnose the root cause of our most deadly public health problems, from heart disease, cancer, to the degrees in which communities are experiencing more serious cases of asthma, mental health crises. You tie this really back to the fundamental problem of capitalism. Could you tell us about the book and your thesis there?
Sure. So we've had the horrible opportunity, those of us living through this period, of watching really one public health crisis after another cascade on the world. Certainly the COVID pandemic, which we've seen, but also the climate emergency, the so-called deaths of despair of less educated, older men from opioids and alcohol and other drugs and guns. And we've seen the continuing stark inequalities in health outcome among Blacks and other people of color and whites. And I wrote this book to try and understand what are the common causes of these this cascade of public health crises, of public health apocalypses facing the world in the first part of the 21st century. And if we can identify and understand some common causes, what might we do? And in the book, I present what I concluded, which is that the changes in 21st century capitalism, the growing corporate globalization of the world, the movement of viruses and unhealthy products and pollution around the world, often in order to make a profit, the financialization of our economy that leads governments and corporations together to privatize previously public services in order to increase profits, to cut wages. A story that's been in the news lately is the buy-up of long-term care facilities and nursing homes by private equity. What do? Once they buy them up? They cut staffing in order to increase profits. And that is a big cause of the high death rate of older people and staff in nursing homes and long-term care facilities in COVID. And a third dimension of 21st century capitalism is the increasing control of science and technology by corporations. And so they end up benefit rather than humanity. In the book, I talk about how the food industry has created a diet, a very profitable diet that happens to now be the leading cause of premature death and preventable illness. The fossil fuel industry has come up with a way of providing energy that is disrupting the lives of so many people. And my book argues that by understanding the common causes, the roots of these problems, we can begin to make the modifications, both incremental and more radical, more transformative in our political and economic systems, to really ensure that we have a healthy, sustainable world for our children and our grandchildren and the people we care about.
As I was reading the book, from an ideological perspective, I identify as a socialist, and a lot of my audience, they're radical. And so just the premise of the book itself, we're like, yeah. But as I'm reading it, you don't do it so much from an ideological perspective, hardly at all. You do it from data, you do it from facts, and you're building a case based on solid evidence. Could you talk about the evidence, and even if you juxtapose it with ideology, but I think your evidence speaks more than ideology here.
Yes, and I think that the advances in public health over the last 2 centuries have come when researchers and social movements together connect the daily experiences, the lived experiences of ordinary people with political and economic systems. And I try and understand what are those connections using the research evidence and my almost 40 years of experience doing public health work in low-income communities to make those connections and then to look at, so what can we do about it? So to give an example, a lot of my work is around food. I think we've seen the development of what some people call the ultra-processed diet, a diet high in fat, sugar, salt, with really hundreds of additives, preservatives, stabilizers, and other things added. And this diet was developed because it's extremely profitable for the dozen or so global corporations that control the food industry: Nestle, Unilever, Coca-Cola, Pepsi, Kellogg's. We all know the names if we ever go in a supermarket. And they found that this highly processed industrial diet made it easier for them to organize and control agriculture, the food production and distribution process, food retailing through giant stores like Walmart and Whole Foods. It really gave them control over the whole food system. And the diet was easy to ship around the world, to leave on shelves, to market, not just in one place, but around the world, to move into undersold markets like Black and Latinx communities where not as many people were buying it. And so now more than half the calories in the United States constitute this ultra-processed diet. And sad to say, the research evidence shows that it is this ultra-processed diet that is associated with the dramatic increase here in the United States, but also around the world, of diabetes, cancer, heart disease, high blood pressure, and more recently of COVID infection, illness, and deaths. So the diet that is good for the global food industry is making us and our children and grandchildren sick. And so the question is, if we want to improve the world's health, we need to figure out a strategy for changing that diet.
And that's actually what your book also, you not only diagnose the problem, but you also offer some solutions. What are some of the strategies that you believe that should be employed in order for us to make, you said, both incremental change, but also radical change and structural change?
Yes, I'll talk about two or three to give an illustration. One is, I believe we need to expand the public sector in our economy and shrink the private for-profit sector. And again, to stick with food, but I also talk about healthcare and education and transportation. In food, actually, taxpayers spend a lot of public money on food. There's the SNAP program, about $70 billion a year. There are school meal programs. And then there are, of course, all the subsidies that the U.S. Department of Agriculture gives to the corn and sugar and soy industries, precisely the industries that produce the raw ingredients for ultra-processed foods. So we're spending a lot of public money on food, but that money isn't being addressed to the public good. Instead, corporations have found a way to get that money back to themselves. And whether that's through the SNAP expenditures for Coca-Cola, or whether it's the agricultural subsidies to Archer Midland and the other big agricultural companies, it's the tax policies that have made it easy for corporations not to pay taxes, whereas middle-income folks like you and me end up having to pay our taxes. And that leads to, I think, the second strategy, which is to look at democracy. You know, in your previous segment, you were talking about democracy. We cannot reclaim our health unless we reclaim our democracy. So I think it's limiting lobbying, limiting dark money, insisting on voter rights and voter registration. And when ordinary people, when the majority have a voice in our democracy, then the efforts of corporations to undermine public health policies will be more difficult. I'm
just thinking about all the different ways since we've all of us were born, we have been almost commodified in terms of how we didn't even. I'm 40 years old, and every stage of every part of my life has been infected with these corporate organizations that have control over our complete diet. Because we can't even go to a grocery store. We can't get food in this country without literally getting it from one of these major organizations that have a vested interest in creating products that harm us because it generates a bigger profit for them. What do you say to a person like me, individuals who are coming to grips with this? Because what do we do when everything on our grocery shelf, just about everything on our grocery shelf, is a part of this problem? What do you say to individuals who want to do something about this?
Right. And just to be clear, what we're talking about now around food, in the book, I talk about 6 pillars of health, the essentials for well-being for individuals and communities. So food, healthcare, education, work, transportation, and then also social connections. How do we connect to other people? And in each of these, just as you've said, the big corporations have commodified our needs for a healthy life and look to make money on it. And when their need to make money conflicts with our well-being, that's the path they choose. So I think we learned a very powerful lesson from the women's movement of the 60s and 70s, and from other movements too. And that is that the personal is political and the political is personal. And we need to find ways to connect the options we have for food and healthcare and education with the political activism that looks to change the policies that limit our choices to what's good for corporations and limit our choices to what's good for us. Our public policies, in our towns and our cities, in our states and in the nation should make healthy choices easy choices. But in so many cases, in food, in social media, which could be a way to connect to other people, what's the easy choice is one that makes some corporation rich and ends up endangering our health. And I think in the book, I look at, so who's been successful? And I think we've seen communities like Philadelphia, Oakland, Berkeley, Seattle that have developed taxes on sugary beverages, a key ingredient that contributes to dietary disease and that drives the inequities in health among less well-off and better-off people and among Blacks, whites, and Latinos. And those taxes generate revenues that go back to communities to, in the case of Philadelphia, to pay for childcare. In the case of Berkeley, to improve the public water system so that the healthy choice, water, is available in every school, in every public park. Right. And so parents, voters, community residents need to be looking for and supporting those efforts that will return to us the right to make choices about our health and diminish the right of corporations to structure those choices so only what makes them rich is available to us.
Wow. Dr. Freudenberg, thank you so much for coming on the program. The name of the book is At What Cost? Modern Capitalism and the Future of Health. Please pick it up anywhere you could pick up books and definitely take a read, because I think it has a significant impact on what we need to be doing for the future. Before we go, just tell everyone how they can connect with you or any other message that you want to leave with them.
Sure. I think there are many organizations in every community that are doing this work. I'm at the CUNY School of Public Health. My email is nick.freudenberg@SPH, School of Public Health, sph.cuny.edu. And I'm happy to talk to people who are who want to learn more about what's going on in their community. And I really thank you for giving me the opportunity to talk about this book.